Hello, everyone. It's just terrific to be with all of you here today. One of the great pleasures I've had during the 5 years of our program together, RX Access, is getting to know many people in this audience across this great nation, in states and in advocacy groups who are working every day to find ways to provide access to the health care people across this great nation need to take care of their health. It's an honor to be here today with you. I think it's no news to anyone here that what many call our nation's healthcare crisis gets down to a very personal level when we think there are over 46 million people who do not have the benefit of coverage and access to health care. Never has it been more dramatic than during these times at unprecedented levels of unemployment. We're kind of waiting to hear this month's new number, but till then we'll look with sadness at over 10.2%, nearly 16 million people who don't have jobs. And those are just the people looking for jobs, because we all know that there are a lot of people who've just given up and a lot of people who are underemployed. Now, this is a problem for people's health, particularly the over 11 million people, and we're talking about the non-Medicare, the under 65 population, who suffer one or more chronic conditions. And it's that population that is most at risk. Of the entire population, we know that 1 out of 4 people who don't have coverage won't fill prescriptions if they go to a provider, and that provider has told them they need medicine. But when we think about that 11 million who suffer chronic conditions, 60%, I'll repeat that, 60% of folks with diabetes, hypertension, asthma, will not be taking their medicines as prescribed. They will be cutting their pills, splitting, skipping, or just not taking their medicine simply because they can't afford it. That's not a good way to manage the health and wealth of America. The Urban Institute estimates that every year over 45,000 people die simply because they don't have access to health care due to lack of coverage. Now, Together RX Access, which is a prescription savings program for the non-Medicare uninsured, is not a solution to these problems. But it is real help right now so people can have better affordability of the medicines they need to stay healthy and manage chronic conditions. It's a prescription savings program that works as a philanthropic initiative that is fully funded by many of the nation's leading pharmaceutical companies, so that hardworking Americans, and by the way, over 85% of the non-Medicare uninsured are working, sometimes 2 or more jobs, so that they and their families can take care of their health. These are the companies that dedicate their products at a subsidy to the program, and they're also the companies that pay for everything that makes the program possible in all 50 states plus Puerto Rico. The card is for people who have no prescription drug coverage and aren't eligible for Medicare. It's just that simple. And the income levels are a little bit over 400% federal poverty. So, for example, an individual who earns $45,000 or less, or a household of 4 earning $90,000 or less, would be eligible for the free program. Now, with these income levels, which our Board of Managers raised last spring because of the tough economic times, we estimate that over 90% of the non-Medicare uninsured would be eligible. By the way, I'm going to go back on that slide, if the button works. You'll see in that upper right-hand corner, we require no documentation for any of those questions. We take people at their word. Isn't that nice? So the program is free to get and free to use, and the savings are real. Most people save 25 to 40% on the brand name medicines and products like glucose testing strips that are available with the card, and they can also save on thousands of generic medicines. I think it will come as no surprise to you, and I think in terms of cost and health access, something that may be of interest to you, the overwhelming majority of products and medicines for which the card is used are for generics. So with the card, people save on over 300 brand name products that are uniquely in the program. They're used to treat most of the conditions, chronic conditions, and some acute that people suffer today. The card is accepted at over 60,000 pharmacies across the nation and in Puerto Rico. That's the vast majority of pharmacies. And we also serve as a gateway to a clearinghouse that helps people learn about other programs for which they may be eligible in order to save more money or sometimes get their medicines for free. And that is the Partnership for Prescription Assistance, or sometimes called the PPA. You've seen the big orange bus that may have been to some of your states. That is the clearinghouse of over 475 public programs, like state Medicaid programs, S-CHIP programs, and private sector programs that sometimes give medicines for free. We make sure in multiple ways that everyone we talk with knows it's important to check in with the Partnership for Prescription Assistance. So once people get their free card, they simply take it to the pharmacy along with their prescription, and the pharmacist then tells them how much they owe, and as we mentioned, most people save 25 to 40% off the full cash price. It might surprise you to know that most people who sign up for this program do it instantly at togetherrxaccess.com. In fact, over 85% of people who enroll in the program are doing it online. This is a major difference from how Medicare beneficiaries sign up for their programs. So to date, we have over 2 million people enrolled in the program. This number is a little bit old. We're now just coming up to folks having saved nearly $100 million by using the TogetherRx Access card. I kind of think, although I don't have data to back this up, that probably people don't by and large sign up for the card unless they need medicine or someone in their family needs medicine. So I like to think that we've come pretty close to hopefully reaching about 20% of those 11 million folks who truly need medicine, often every day, to take care of chronic conditions. So I'm especially happy to be here today because there are many, many more people who need not only to know about TogetherRx Access, but they need to know there are other programs that can help them have better access to medicine and health care. And in many ways, this is a gateway program to let people know that there are ways that they can connect in the public sector and in the private sector to have access. So I'm delighted that you're here today because we would like to collaborate with you to get the word out, however and wherever you can, back in each of your states, through your legislative offices, through town halls, through health fairs or other community events. We can provide you with copy-ready material for your communications, e or print, so that people, the constituents you serve, will know that there are programs like this that can provide them with access as we wait for comprehensive health care, whenever and whatever that may be. These are some of the materials. We can provide a link. You can friend us on Facebook. I think that's kind of cool. We're getting really with it. And if you talk to the media, we would love to have you let them know that these are tough times. There are many people who are suffering from lack of coverage, but there are programs that can offer real help right now. So thank you so much. It's an honor to be sponsoring the beginning of an important legislative session with ALEC, and thank you so much. Most importantly, I hope you all take care of your health.